and sediment or implies. So we'll just see. As an introduction, so this becomes the most common neurological disorders affecting approximately 1% of individuals older than 60 years. Fortunately, this is a disease which affects to the old age people most commonly and characterized by progressive nature, unknown precise etiology. Not only that, there is no a confirmative management in the parallel system, that is modern medicine. So these are the advantages of this disease in our hand. So we will just go to the. So I'll just let me the conclusions of my presentation. A brief introduction, pathophysiology, then the staging of the disease, Ayurvedic interpretation of pathophysiology, then stage-wise protocol, and finally a making of a standard operative procedure in the management of Parkinson's disease. So these are the contents of today's presentation. So now we will just see the pathophysiology according to modern in very brief. And absolutely, I think this, I don't want to spend much more time on these principles because these are all available in the literature, in the modern literature. So, and it is quite accessible to everyone also. So, of course, the disease is caused due to the destruction of dopaminergic neuron. And so there will be some defects in between the signaling pathway. The sites affected in the manifestation of the disease in the brain are mostly it's thalamus, then lentiform nucleus, substantia nigra, and these are the common structures that being affected in this kind. So just you can keep in mind, and these kind of lots of researchers and lots of this anatomies are available in the literature. So better not to spend much on this. So now we will just see how was the evolvement of this disease. The disease is being identified in 1817. That is in the year of 1817, they named the disease as Parkinson's disease. Later, in the year of 1912, probably after 100 years, they discovered some structures called as Levy body, which are the reason for the manifestation of the disease. And later, so up to this time, this 100 years, the management of Parkinson's disease was based on the pathology that happening in the brain itself. And in 1997, you can see this, it's quite recent. And another structure called as alpha-synuclein was discovered, and they discovered that the Levy bodies, the reason for the destruction of, or the reason for the formation of Levy bodies are nothing but it's another material called as alpha-synuclein. And in 2007, again, it's very recent, the relation between Parkinson's disease and the structure, the chemicals called as alpha-synuclein and Levy bodies was proved. And in 2010, that is around what we can say 15 years back, the relation between gut and brain, that is the gut-brain axis and Parkinson's disease was discovered. So this is the progressive, this is the development or evolvement of whatever the developments which has been happened in the modern medicine till now. Now, we will just see what is the actual pathophysiology pathology, what happens then? Yeah. So it's nothing but initially the formation of alpha-synuclein. And from this alpha-synuclein, the formation of Levy bodies. And these Levy bodies travels through the pathway, that is the gut-brain axis, and reaches to these Levy bodies are formed in the gut, and then it travels to the brain and reaches the brain and sediment or lodges there and affects the thalamus as well as substantia nigra, etc. structures. So this is the a sequential development of the disease. Now we will just see how the disease is being staged. So in 2003, there is what we say, a method of staging. A neurosurgeon called Brack has what we say, he has introduced a new staging in this in the management of this Parkinson's disease, and he explained the stage by stage development of this disease, that is from gut to the brain. So how the disease is being manifested in the gut and how it's being derived or how it being progressed to the involvement of brain. And this staging is called as Brack's classification. And you can just Google it and you will get that more details regarding the Brack's staging. And this is quite important. And the entire presentation is based on this staging. So, what is how does it happen? That we will just see. So this is the actual staging. You can just see this. I'll show you. So actually, this is the first stage. This is the second stage, and this is the third stage. And see here, in this first stage, the brain is completely spared. There is no involvement of brain in here. So here, the pathology happens somewhere here. That is especially the gut. And from this gut, it travels through to the brain through different structures. And in second stage, you can just see this area is being affected. And in the third stage, and the disease is being little more progressed, and you can just see the pink or rose color which are being affected by the Levy bodies. These are all we can consider as the deposition of Levy bodies. So initially, the Levy bodies developed here, and in the next stage, from here, it travels to here, and the next stage, from here, it travels to the entire brain. So this is the actual development of staging. So now we will just see what are the symptoms which are manifested in each and every stages. So symptoms in each and every stages that we will see. Now, while understanding just analyzing these symptoms, I think you will get a clear picture regarding the management. The presentation you need not to be watched, because from this slide itself, you will come to know what is the actual pathology and how to be managed. Yeah, so you can just see Brack's staging 1 and 2. categorize this as three stages, that is pre-motor phase or motor phase or clinically evident phase and complication phase. So the management protocol is entirely dependent upon all this staging. So we will just see. So the first phase, the symptoms are hyposmia, constipation, depression, articular pain, and fatigue, and orthostatic hypotension. So these are the symptoms which are manifested in the first stage of the Parkinson's disease. We never think of these kind of symptoms, right? Hyposmia. So many of the patients come to us with simple complaints of hyposmia. Do we know that? Well, do we know that that person may affect Parkinson's disease after 5 or 10 years? So it's not that each and every patient comes to us with anosmia may develop Parkinson's. There may be so many different causes, right? So what we say, this kind of frontal sinusitis, it can any normal, any mild, what we say, the neural defects can happen. There are so many reasons, but we should keep in mind, and this can be a prodromal symptom of a futuristic or a Parkinson's disease, which are going to be manifested after 5 or 10 years. The second one is constipation. Do we think that constipation in a Parkinson's disease or a patient with chronic constipation can develop Parkinson's disease? No. But that's the truth. It may not be next month or next year, etc. But a patient with chronic constipation can develop the Parkinson's disease after 5 or 10 years. Then fatigue or articular pain and orthostatic hypotension. These are may not be able to analyze properly, but always in case of patients with hyposmia, probably it's a chronic hyposmia or anosmia, chronic constipation, etc. We should think that there are some possibilities for the development. And the next phase, the specific motor symptoms. So you can just see what are the motor symptoms. Bradykinesia. Bradykinesia is nothing but rigidity, the stiffness of movement. See, every patient comes to our clinic, or the diagnosed Parkinson's disease patient may not have tremor or shivering as a symptom. Most of the Parkinson's disease cases manifest as movement restrictions or movement rigidity in the initial phases. He won't explain, we will never think that the patient will get stiffness, or the patient may be getting stiffness while moving. He may not have control over his limbs, maybe while walking. He may not. He won't say that I lost my control, or my what we say I lost. I'm not able to move my limbs, etc. The presenting complaint will be just like the dragging of feet, and he will not be able to move speedily. Sometimes the patient may not be understanding this. His relatives, probably wife or children, will be observing this issue. Previously, this patient, sir, my father was walking very fastly previously, and now since last 1 or 2 years, is not able to walk fastly. Or he may, and sometimes while taking food, my husband was was taking this food or eating much speedily. But since 1 or 2 years, he's not able to do it fastly. These could be the presenting complaints by a patient. So always we should think that within 1 or 2 years, this bradykinesia or stiffness or rigidity can be progressed to a tremor or shivering. So if we could diagnose the tremor or the disease which is going to be manifested after 4 or 5 years, if we could diagnose now itself, the treatment is going to be much easier and it's going to be much faster also. See, isn't it? Sanchaya, this is the Sanchaya stage. Kriya Kala. Sanchayena Bahrita Dosha. Labhadeno Taragati. If we could control the disease in the Sanchaya Avastha itself, Labhandeno Taragati, that won't be progressed to the next phase. And the Brax stage 5 or 6. These are the 6 stages. The first one includes 1 and 2, and the second 3 and 4, and the stage of complication, that is 5 and 6, in which the memory impairment, sleep disorders, acute delirium, nocturia, dysphagia, etc. manifest. So what is the importance of knowing this staging? Because the management is entirely different in each and every phases, isn't it? Can we follow the same protocol in a patient coming with tremor as well as rigidity? Both are Vata Vyati only, right? But the management is entirely different. There lies the importance of understanding the disease. So now we will just go to the pathologies once again, right? So I'll just so this is the actual stage-wise development. So you can see this. These are because of the continuous inflammation, probably intestinal inflammation, loss of microbiota, and the chronic constipation, etc., can lead to the manifestation of alpha-synuclein. And this alpha-synuclein affects or produces the Levy bodies. And these Levy bodies moves from the stomach to the gut through different nerves as well as to different conductors. Everywhere there can be some inflammatory triggers. So the reason for the formation of this alpha-synuclein or Levy bodies can be different kinds of intestinal inflammation, or maybe continuous systemic inflammation also it can manifest. And this process forwards and reaches to the brain. And you can see the deposition of this kind of factors. These are the Levy bodies which are being deposited in the brain and which manifest the entire and which affects the entire area and develop at Parkinson's disease. So now, this is the basic development of Parkinson's. Now we will just go to the next phase. So as I explained previously, the premotor phase lasts around 5 to 10 years. Motor phase can last 5 to 10 years, and complication phase can last up to 10 years. So if the management was not proper, the lifespan of a patient with Parkinson's disease can be from the onset of symptoms. From the day of onset of symptoms, the lifespan can be 20 to 25 years. Of course, there will be some phases, active as well as inactive phases will be there. After 5 years, there will be an inactive phase. And maybe from that inactive phase, maybe after 1 or 2 years, again, the disease gets progressed more and more. So, a patient with chronic constipation, a patient with chronic hyposmia, a patient with chronic depression, or unexplained joint pains, easy fatigue, etc. can manifest or can be developed to a the full developed Parkinson's disease in next 5 to 10 years. And motor phase. The motor phase is, we can consider this pre-motor phase as Purva Rupavastha and motor phase as Rupavastha, and complication phase is Vyakti as well as Bhedavastha. Initially, in motor phase, that is Rupavastha, the disease manifests as bradykinesia. Bradykinesia is nothing but restricted movements. Difficulty is not tremor, but difficulty in movements. Rigidity. These are the first two symptoms in a Parkinson's disease, in a patient with Parkinson's disease. Then tremor, then develop into a tremor. And lastly, in that phase, that postural instability. After 5 to 10 years, if these are all not managed properly, this can progress again to memory impairment, sleep disorders, nocturia, and dysphagia. Most of the cases dies with the condition of dysphagia, as well as the respiratory paralysis. So this is what the treatment. Now, we will just have a rewind with our medicine, our principles. Till now, we have explained the modern pathophysiology, and now it's the time to analyze the already revealed modern pathology with our own principles. So, to be started from Adya Karmavasara or Prathama Kriya Kala. So this entire Bragg's classification, we can say that it's the word-to-word translation of our Kriya Kala. So probably the Kriya Kala we might have learned in the all the professions, right? In the first profession, we have learned this in our Kriya Sharira. In the second profession, we have learned this in our Roganidana, the application part. We have learned in this Roganidana, and finally in the Kaya Chikitsa paper. Still, is the principles are clear to us? Do we apply these principles in our treatment? It's quite easy. It's quite easy to apply the principles of Kriya Kala. Not only in this Parkinson's disease, we can apply the principles of Kriya Kala in each and every disease. So how to apply? That's what I said. The management protocol for this Parkinson's disease can be set as a model protocol. So what could be the? We know this Kriya Kala, 6 Kriya Kalas are there explained by Susruta in Vrana Prasna. Sanchaya, Prakopa, Prasara, Sthana Samsraya, Vyakti, and Bheda. Right? The management of in each and every stages are entirely different. He clearly explained the importance of Kriya Kala. He explains as Aprapteva Kriya Kalo, Praptevana Krita Kriya, Kriya Hinadiriktava, Sadhyeshu Vina Siddhyati. If the management protocol was wrongly adopted in the stages, that means if we did the treatment to be done in Prakopa Avastha, in Sanjaya Avastha, that can cause even the sadhya rogas also can be manifested as asadhya, can be turned as asadhya. So the stage-wise protocol is quite important. Shite, Shita Pradikaram, Ushne Ushna Vinischayam. Isn't it? This is what Acharya explained. Krutva Kurya Kriya Praptam, Kriya Kalam na hapaye. Without understanding Kriya Kala, we cannot form a stage-wise protocol. This is what he explained. Prapteva, and he explained some examples also. Anagadehi kriya kale kridana siddhyati tatha cheduktam bheshajam hyamadoshaje. If we have given this kind of bheshaja with the Sitavirya or Brahmana, etc. in Amadoshaja, that causes the even death of the patient. This is what the importance. So here the management of Shatkriya Kala or the management of Parkinson's disease can be designed according to the Kriya Kala. How to do that? How to define? How to design a protocol? That we will just see now. See the first phase. Usually we can consider this and we can categorize to 8 or probably the 8 phases. The first phase is intestinal inflammation, loss of intestinal microbiota. Because of the continuous intestinal inflammation, there will be the disturbance to the vagus nerve and production of alpha-synuclein. And this alpha-synuclein travels through the vagus nerve, and then this alpha-synuclein and Levy bodies gets combined, reaches to the movement of these Levy bodies to substantia nigra, and because when it reaches to substantia nigra, that causes the destruction of dopaminergic neurons, and finally that leads as manifestation of Parkinson's disease. Now, as per the recent studies, even though the site of lesion is in brain, it is being identified as gut is the starting phase. The pathology develops in the gut. So the dosha sanchaya happens in the gut, and then it moves to that and progress to and get vekta avastha or bheda avastha in brain. So this is what the stage of the progression of Kriya Kala. So we have to consider the importance of gut-brain axis. The symptoms like constipation, hyposmia and fatigue, etc. starts years before the manifestation of the disease. So these symptoms gives clue against the chief complaints which were going to happen in near future. This is what the importance of staging or knowing the Kriya Kala. So now we will just see Sanjaya, what happens in Sanjaya Avastha of a Parkinson's disease. How to identify the Sanjaya Avastha in a Parkinson's disease. So always our treatment should start at the Sanjaya Avastha. If we could start it in Sanjaya or at least in Prakopa or at least in Sthana Samsraya Avastha where the Purvarupas are getting manifested. At least in that phase, if we could identify the disease, we'll be able to manage more easily. So, Sanchaya, Chayo iti praharshena chiyante yatha sthanacha dosha. This is the explanation by given by Chakrapan. Or Samhati Rupavritti. Samhati in the sense a compact. So, a kind of development or increase without changing the structure. That's what Samhati Rupavritti. So here in this case, the chronic intestinal or systemic inflammation as well as loss of gut microbiota can be considered as a the Sanchaya Avastha. And this intestinal microbiota we can consider this as Sahaja Krimi. Isn't it? Chakrapani clearly mentioned in the Vyathidaru in the Vimanasthana, while explaining the Krimi, Chikilsa, Acharya explained there are two kinds of Krimi. That is Tatra Sahaja and Vaikarika. So out of this, Chakrapani clearly mentioned as Tatra Sahajani Avaikarikani. So the Sahaja Krimis are Avaikarika. That means that won't cause any kind of disturbance. So why can't we consider this Sahaja Krimis as our the lactobacilli or in a kind of intestinal microbes which helps in the digestion. And And so the loss of gut microbiota can be considered, as well as the intestinal inflammation can be included in the Sanchayavastha. Now, the second stage, Prakopa. Sthana Dunmargamanam, Prakopam. See how clearly Acharya explained, how clearly this the pathophysiology sets into our own theory. Sthana Dunmargamanam, Prakopam Parikirtidam, or Vilayana Rupa Vritti. Vilayana Rupa Vritti in the sense that the flowing kind of increase. So here Sthana Dunmargamanam, the movement from its own phase. So we can include the production of, as I explained, this alpha-synuclein and irritation of vagus nerve in Prakopavastha. Now, Prasara. What is Prasara actually? Prasara is Sarvadehanusaranam Prasaram Bhishajam Vidu, is the commentary given by Narasimha. So, Prasara is nothing but Sara, we know the flowing. So, Prasara in the sense Prakarshena Saram. That means which the high amount, the flow with Prakarsha, that is the highly increased mode of flowing. And this is called as Prasara. So, and he also explained as Tinnodaka Pishta Samavayam, just like the idli batter or dosha batter, etc. That if we keep for overnight and the next day that gets spilled from the pot. And such kind of increase can be considered as the Prasaravastha. So the production of Levy bodies and dislodgement of Levy bodies to the brain can be included in this Prasaravastha. Now, Sthana Samsraya. So we know this, what is Sthana Samsraya. In Sthana Samsraya Avastha, we get proper, we get the Purva Rupa Avasthas are manifested. Deha Egadeshasrayam Sthanam. So the dislodgement, the manifestation of Purva Rupa, or the settlement of Levy bodies and alpha-synuclein at medulla and pons tegmentum can be considered as the Sthana Samsraya Avastha. And up to this, we can maybe we may not be able to diagnose properly. And from this phase, the pre-symptomatic phase starts. So that means the constipation, hyposmia, etc. starts from this phase. Now, Vyaktavastha. Vyadhe Pravyakta Rupam Vyakti. So the manifestation of disease in fully recognized form. Here we have to give Vyadhi Pratinika Chikitsa. Up to the previous phases, we have to give the Hetu Viparita Chikitsa. That means we have to find out what is the reason for the increase. We know this Vata has been increased here, if, or Pitta has been increased, or we have to, Kapha has been increased. So we should find that, up to this stage, we should find that which guna this Vata has been increased. See, this Vata can be increased with Ruksha, Lekhu, Shita, etc. The treatment principle of Vata Vriddhi produced due to Shita Guna is entirely different, which is produced due to Ruksha Guna, right? If a Vata, how to understand that? That we have to ask the Nidana to the patient. So, if a Vata Vriddhi, in a patient coming with to our clinic with severe joint pain, and if that patient has a habit of continuous exposure, or maybe some kind of fisherman, or any other kind of jobs in which he has to dip his legs always in water, definitely there will be a Vata Vriddhi. The treatment of that joint disorder is entirely different with the joint pain which is produced due to Rukshopasevana, right? If the Vata Vriddhi happened due to Shita Guna, excessive usage of Shita Guna, then we have to treat with Ushna Guna Pradhana Dravya. If it is due to Ruksha, we have to use with Snigdha Guna Pradhana Dravya. If it is due to Lekhu, we have to treat him with Guru Guna Pradhana Dravya, right? If any kind of GIT disturbance happened or severe constipation happened because of the continuous usage of black tea or black coffee, which is highly ruksha in nature, or by the continuous, he has the habit of taking bread with maida or any other, or this rusk kind of things, which are highly ruksha in nature. So the treatment is different. We have to supplement their snigdha guna. So up to this stage, so we have to find out by which guna the increase happened. The same is can be applicable in pitta and kapha also. The treatment of pitta vruddhi due to ushna is nothing but shita pradikaram. The treatment of pitta vruddhi due to snigdha is nothing but ruksha kriya. The same like kapha also. The treatment of kapha vruddhi due to snigdha is ruksha. At the same time, if it is due to shita guna pradhana, the treatment is ushna. So the entire the treatment line becomes changed up to this phase. And once the diseases are manifested properly, then we are supposed to give the vyadhi viparita chikitsa. So now we will just see what is the other phase. So in case of bheda avastha, we know this, where the bheda avastha is the phase of complication. So the disease becomes chronic. Bhedo hi vishesha sacha pradhamotpanna kalandara bhavi chikitsa. So the stage of complication. The disease becomes chronic and complications starts to manifest. Complications like memory loss, delirium, sleep disturbance, etc. starts in this phase. So this is how we can categorize the phase. Now, in short, so last 35 slides, we will conclude or we will concise into one single slide. So the first premotor phase, that is Sanchaya, Prakopa, Prasara and Sthana Samsaya. The symptoms will be constipation, hyposmia, depression, articular pain and fatigue. This phase can last up to 5 to 10 years. And then the Vyakti and Bheda Avastha, that is motor phase, which lasts for 5 to 10 years again. In this phase, this bradykinesia, rigidity, tremor, and postural instabilities happen. In the last phase, that is the complication phase, that is after maybe this may last up to 7 to 10 years. So memory impairment, sleep disorders, acute delirium, etc. What we have learned till now. So this slide becomes the summary of all the previous 34 slides. Now we will just see some of the interesting studies. See how a constipation and this Parkinson's disease are related. So these are the quite recent studies. So all these studies, if we are analyzing, I'll show you the studies later in the slide. So constipation, they finally conclude that constipation is the most common GI symptoms which manifest as premotor symptom. Who has lesser than one bowel movement per day had over 4-fold increased risk of PD diagnosed over the next 24 years compared to men with regular bowel movement. If a person passes or his bowel movement once in 4 days or once in on alternate days, is 4 times susceptible to the development of Parkinson's disease in the coming 25 years. See, in constipated men with twice or thrice in a week were 5 times more likely to constipate. And if it is with women, it's 3 times more likely to be diagnosed with PD in 6 years. These are all the different studies which has been conducted in the modern medicine field. And the duration of this is quite important. the duration of time over which constipation is predictive of PD development is remarkable. But both prospective and retrospective studies have found that constipation becomes an apparent at an average of 15.6 to 24 years before PD is diagnosed. So, always a patient with chronic constipation, even without any familial background, is more highly susceptible to the this kind of Parkinson's disease in at least in our coming 15 or 20 years. And you can see this final stage of that study, the final word of that study, makes it one of the earliest indicators of pathological process that ultimately lead to PD. This is what we say, right? If this is what we have been saying since our centuries, right? We need to do the proper bowel movement. We need to do the apana anulomana. Once that apana anulomana happened, all the other functions become normal. So if we say as if in the modern world, it can be, it's been explained, it can be considered as Bermuda. And the same thing, if we wear, and maybe like an undergarment. So this is what the new studies show. Now we will just see. These are the different studies. You can just note down that, and that will be there in the presentation. So the 4 or 5 studies I have quoted that. The last study was in 2015. And now depression. Association with anxiety disorder remains significant for disorders present 5, 10 or 20 years before the onset of symptoms. So how the mental health is important. Now, anosmia. We never think that a patient with chronic anosmia can develop Parkinson's. The data support the hypothesis that the olfactory deficit of PD is general and stable, one which likely occurs in early the disease process. As significant olfactory impairment were found in early de novo PD, olfactory test may be useful. See, you can see this. This is what the new test has been there. They are using that. Olfactory test may be useful in the early diagnosis of PD. So, how the Purva Rupavastha gets importance here. So these are the different studies. Now, let us see Chikilsayam Prathanam, Avasthanu Vidhanam. From this slide, the presentation turns to the completely of this Ayurvedic point of view. So how to understand how to analyze the stages through our own diseases, our own theories. We'll just see. So diseases to be considered here are Udavarta. We have to consider the principles of Udavarta. Vadiga Grahini. Then Vadiga Pandu. In the initial phases. And motor phase, Avarana. Different kinds of Avarana, maybe Kaphavardhavata or Pittavardhavata. Then complication phase. Probably Dhadu Ksheja or Vadakova. So this is how we have to, these are the structure or the disease entities that we have to consider. So now, what are the premotor phase and Purva Rupavastha? How to consider, what are the factors that has to be considered here? So now we will just see the Udavarta, right? Mudgako Dravajurna Chari Karira Chanakadithi start. Udavarta is the complication of ulcers. In the ulcers Chikitsa only, the Udavarta is being explained. And Ruksham Sangrahibir Vayu, Swasthane Kupitobali, because of the excessive Ruksha kind of factors. Swasthane Kupitobali. Then Athovahani Srotamsi, Samruddhyatha Prasoshen, Athovahani Srotamsi, the Srotas which are located in the Athovagavasira. Then what are the symptoms? Purisham, Vada Vinmutra Sankam, Viparita Daruna. The Purisha Sanka, Vada Sanka, and Athu, that is Athovada Sanka and Mutra Sanka. Then Teneva Tivra Ruja, Oshta, Prishta, Parshwartika. And so here we have to consider the Vega Dharana also. Atho Vadasirodhena, Gulmodavartaruklama, Vadamutra Shagrat Sangam, Drishti Agnivatha Rudgata. Right. And this is the reason, probably this could be the reason for the development of Udavarta. And from this Udavarta, what happens? Vastaucha Sutaram Shulam. There will be the pain over that area. Pavanasya Urdhogamitvam, Tada Chardya Rojam. Pavanasya Urdhogamitvam. The Apanavata gets dislodged from the Koshta to the other face. And what are the symptoms which are happening? Badhiryam, Timiram, Shwasa, Rupir, Kasapenasam, Manovigara. Here comes the depression. Manovigara, Stratrishna, Astrapitta, Gulmodaradaya. And finally, he explained as Te Techa Vadaja Roga. So all the Vadaja Roga, that means all the Ashidi, the 80 kinds of Vadaja Rogas can be manifested as this Udavarta. This 80 kinds of Achiti Vada Rogas, nothing but starts from Nagabeda, Vipadika, etc. So these are the Udavarta Lakshana, which is explained in our text. So how can we correlate this? Badhirya, Timira, Shiroruk, again Koshta Daha. once again,